I'm Richard Phillips, a journalist with the World Socialist website, and today I'm speaking with Professor Guy Marks. Also joining us today is Max Boddy, who is the Assistant National Secretary of the Socialist Equality Party in Australia and a WSWS journalist. Professor Marks is President of the International Union Against Tuberculosis and Lung Disease. He's also the current head of the Respiratory and Environmental Epidemiology Group at the Wilcock Institute of Medical Research, and he is Professor of Respiratory Medicine at the University of New South Wales in Sydney. Earlier this week, Professor Marks and two other senior epidemiologists in Australia issued an urgent appeal entitled, "Backed by Science, Here's How We Can Eliminate COVID-19. The statement was published amid an unprecedented surge of COVID infections across Australia and internationally. The statement calls for sustained and globally coordinated action to eliminate the deadly virus. Professor Marks, why did you decide to issue the statement now, given that you've been publicly, all of you have been publicly warning about COVID and the measures that should be taken for a very long time?
Look, I think that's a very good question. Thank you first for having me on this podcast, and it's a great pleasure to be here and to have the chance to share my views here. And that's a good question. I think the reason that we published it and have been concerned about it is that we're increasingly concerned about the direction of the public conversation around COVID, and clearly it's a very emotive conversation. This issue is a major threat. It's been a major disruption to everybody's lives, but we're concerned that for a variety of reasons. There is a lack of focus on the things that need to be done to control this pandemic. And I think those reasons are in some ways obvious, in some ways less so. I mean, the obvious reasons are that people are weary of this pandemic. And in that article, I referred to sort of war weariness. Which in this case is really pandemic weariness, where after 2 years, people just want it to go away. And there is a sort of narrative going around that, in fact, you can want it to go away and it will go away. And clearly, that is not a logical way of thinking, that wishing for something does not mean it will happen. But that narrative is being supported by some people, some commentators who appear to have the belief that the pandemic will bring itself to an end, that in fact it will naturally come to an end, and that we just need to ride it out, as it were. We just need to wait and be patient and ride it out. Now, I guess our view was that is a rather dangerous assumption. It is possible that is in fact what will happen, that eventually it will disappear. But our feeling is that two things. One is there is no certainty that will happen. And secondly, even if that does happen eventually, it may well be that there'll be a lot more death, disability, and severe illness between now and that time. That in order to reach the point at which it extinguishes itself could be a very painful process. And so that's one part of the argument. The other issue is the sense of hopelessness, I think, that there have been amongst a number of people, the sense that, well, maybe there's nothing we can do about this, and therefore there's no point in trying to do anything because there's nothing we can do. And I also think, that's sort of the other side of the coin. And I think that's not true either. You know, there have in fact been very substantial things that have been achieved already. And it's my view that we don't yet have all of the tools that we need to bring this to an end, but we are on the way to getting them. And we have effective tools already, but not, and they will get better. But I think we should remind ourselves that even in Australia, we did manage to eliminate this infection on several occasions when there were small epidemics in Sydney, or epidemics in Sydney and Melbourne, not so small actually, and they were eliminated, in fact, even without a vaccine, using public health measures. And then since that time, we have had a vaccine, and we've deployed that vaccine extremely effectively. And the vaccine has in fact saved a great many lives and a great deal of severe illness. So we have had many successes already, but we need to go further. And that article was about some of the ways that we can go further with the tools that we have now, and that we need, where we need and might expect new tools that will enable us to go even further towards elimination.
Guy, could I ask, when did you first start advocating for a global elimination strategy?
I'm not sure when I first started advocating for it, but I've certainly been aware of the fact that it's it's been apparent that it is unlikely that we can eliminate this in just one country at a time. So that's what. So one issue is elimination. The other issue is global. Okay. So so I think the elimination strategy, myself and my colleagues on this article have always felt that it is unlikely that we'll be able to control this epidemic at some low level, that we need to look at elimination as the way of dealing with it, not simply allowing it to run. So that's been a view that I've held and my colleagues have held really since the outset of the epidemic, of the pandemic. I think it's not unique to COVID. That can relate to other infectious diseases as well, which we could talk about later. But and then the other issue is global versus local, is that particularly in this modern era of global trade and travel and trade and travel, is that it is impossible to envisage that we can do this one country at a time. That it's a highly infectious virus. People with it move around, and it will, if we have the disease anywhere in the world, it will soon be everywhere in the world. And so we can't sort of allow some parts of the world to be. We can't expect that we can eliminate it in a sustained way in any part of the world without eliminating it globally. We were able to eliminate, as I said earlier, we were able to eliminate it in Sydney and in Melbourne when it came. And we were able to sustain that elimination for quite a long time by closing the borders. Okay, but that was a very painful thing to do. And in fact, it didn't in the end work because of leakages from quarantine and other ways that the virus continued to come in. So even with a very stringent quarantine system and in living on an island like we do, a very big island, but nevertheless an island, it proved to be pretty much impossible to completely keep the virus out because it was proliferating elsewhere in the world. So that's why it's been apparent to me that if we're going to go for elimination, we have to go for global elimination.
Yeah, just if I could ask another question in relationship to that. You also raised the point in your article that, or you reject what you describe as a vaccine-only policy. And that brings me to the point that when you and your fellow scientists raise the question of global elimination, it's a perspective that is not in the official narrative. I mean, you are, as far as the mainstream media is concerned and the official politics, it's not on the agenda. It's not their narrative. However, many millions of people around the world obviously would be supportive of such a policy if it was implemented. You know, what's been the response to your article from fellow scientists?
That's a good question. And I think it's fair to say that there's been a mixed response. There are many people who are, as you suggest, very enthusiastic about the possibility of global elimination. And there are others, of course, that are very skeptical about it. And both those positions are reasonable. Let me just say that I think a vaccine-only approach could be possible, but not with the current vaccine and not with the current level of uptake of the vaccine. So we have, in fact, eliminated smallpox essentially by a vaccine-only approach. And we've more or less eliminated, we've nearly eliminated polio using a vaccine-only approach. And measles is, in many parts of the world, largely eliminated, including in Australia, by essentially a vaccine-only approach. And that's because for those three conditions, we have very effective vaccines, and we're able to achieve vaccine coverage in the relevant populations that was sufficient to lead to actually herd immunity. That's where the concept of herd immunity comes about. Where it can be achieved with a vaccine for long enough to lead to the elimination of the virus or of the organism. And I think in theory that could be achieved with COVID. It's just that we would require, and I mentioned this in the article, we would require a level of efficacy against transmission. We would need a vaccine that prevents the transmission of the virus from one person to another that was quite high. And we would also need quite high vaccine coverage. There's a sort of relationship between the two. If you have very high levels of efficacy against transmission, then you don't need quite as high a level of coverage. On the other hand, if you have very high levels of coverage, you don't need quite as high levels of efficacy. But at the moment, we don't have high enough levels of either of those things to achieve herd immunity and to achieve elimination. So what I'm arguing is that and I don't think we can do this with the current vaccine, but with the vaccines that are under development, if they prove to be successful, then it may be possible to do it either with a vaccine alone or with a vaccine plus. And the plus are things that I'm saying that would augment the efficacy of the vaccine in reducing transmission. And so there are other things you can do in addition to increasing immunity by vaccination. And they are essentially wearing a mask wearing, and improving indoor ventilation. They're the two key things that reduce transmission. So if the sum of vaccine efficacy, vaccine coverage, and other measures that we take to reduce transmission, meaning masks and indoor ventilation, if they all add up to enough to reduce what was called the effective reproduction rate, people have heard R0 or R effective, below 1 for a long enough period, for a few weeks, everywhere in the world, the virus will extinguish itself. That's the sort of vision. It would need to be everywhere in the world that we could reduce transmission. It only needs to happen for long enough for the virus to extinguish itself, which only needs to be for a few weeks, actually, because this virus, as far as we know, doesn't have any sort of latent capacity. It doesn't hang around. Once the virus is gone, it's gone. And so it could be extinguished in that way. So that's the vision, if you like. Whether that's achievable is where the skepticism comes in. You know, people say, well, we can't cooperate like that, or we're not going to have the tools that can do those sort of things. Well, maybe we won't, but, you know, we put people on the moon 50 years ago. That was a pretty remarkable achievement. There's lots of things. It is a moonshot type of endeavor, but these things, you know, I think you have to have vision first, and you have to have people sign on for that vision, and then you need to work towards it. That's my
I
view.
mean, it is skepticism, but it's not skepticism in the abstract. There is a deliberate promotion of such skepticism because it cuts across the drive for profit. If we took, for example, the lead up to Christmas, I mean, a pretty good example. Everyone, eminent scientists everywhere were warning about Omicron.
Yes.
This was going to unleash a whirlwind, and it has. But the powers that be declared that no, Christmas and Christmas shopping and all of that was almost sacred, and you could not contravene this. And they began lifting all sorts of measures, and we had the promotion of the idea that it'd be a wonderful Christmas. Where was it? The chief health officer declared that if everyone got COVID, that'd be a wonderful Christmas present because it's mild anyway.
Well, yeah, I think certainly there's been, right from the outset, a narrative that, you know, of this choice between health and the economy, as if the economy, you know, as if we had a choice between dealing with the virus or allowing the economy to flourish. And, you know, that has been repeatedly, including over Christmas, but before then, for the last 2 years, repeatedly been shown to be a completely false dichotomy. We cannot have a thriving economy in the context of a pandemic. And anybody who thinks that we can is just a fool. I mean, that's been shown time and time again. That governments might say we want to open up the economy, but customers are not going to go. Nobody wants to go to a place where they're likely to get, you know, a serious infection. People are more sensible than that. So, you know, the reality is that it's not a choice between the economy or health. You can't have a healthy, a thriving economy in the context of a pandemic. You have to solve the pandemic. But Richard, I think the other issue sort of that is coming back to what I was talking about, this sort of global solution, and the idea is that what I'm talking about is global cooperation, is international cooperation. And there's been a huge thrust in the last 4 or 5 years in particular into putting up borders and into, you know, sovereignty and into basically nationalism and you know, America first, Brexit. They're the two very obvious examples of it, of this sort of national, you know, and Hungary, what we see happening in Hungary, this sort of incredible and the opposition to global entities like the United Nations and WHO, this sort of demonization of global cooperation, the view that global cooperation is sort of some dreadful global government and that it's some ogre that is coming to control us from outside. And that view is, I think, finds a home in the people who react negatively to the suggestion that to solve this crisis, we actually need to cooperate across the globe. We need a global solution to this. And the people who think, I don't want to cooperate with people in other countries, I want this to be an Australian solution or an American solution or a British solution, those people find it anathema, the idea that actually the solution requires global cooperation. And I think that's a level at which we're seeing resistance to this. That's the sort of subtext that I get from some of the reaction to the article that we published.
Just a question, did any other, I don't know of any other publications who published your story apart from the World Socialist website and the Health Policy Watch? Has it been published anywhere else?
I don't believe it's been published elsewhere. No, I don't think so.
It's certainly been ignored by the Australian media.
Largely, except there was an article in the Australian Financial Review from Aaron Patrick, which was critical of it, referred to it and was critical of it.
Right. On what grounds?
It's hard to tell, actually, but basically, I think thinking that it was unrealistic. The skepticism sort of article, the skeptical view.
It's interesting. What caught my eye was the opening paragraph where you began with World War I and made a comparison, and it's interesting because on the World Socialist website, we have made a similar comparison with the pandemic as well. Because World War I was we describe it as a trigger event. You know, the processes that led up to World War I were already there. You know, the conflicts between the imperialist nations, etc., they were building and developing. And you know, August 1914, and it all exploded and erupted, and it revealed many, many things about the state of society. And it went on and on and on. The deaths went on and on. So there's many parallels with what's happening today, and it seems it's not even clear how much death the powers that be are prepared to accept. There seems to be no limit. And those that argue, as you have done, that we need a global solution, it can be eliminated, that advanced proposals, the fact that these things are brushed aside is not sort of an inherent skepticism. You know, there are reasons for it, and it's primarily the drive for profit, the maintenance of profit, and that's why we argue it has to come about as a result of a movement below, a mass movement of ordinary people that's going to, in alliance with scientists, it's going to precipitate the development of an elimination policy. And that's our standpoint. That's our struggle to educate, to combat the confusions, to present scientifically based ideas and argue not just the necessity for it, but the possibility. And you know, as you said, in Australia, it's been demonstrated that it could be suppressed. China is the most extraordinary example. You know, a country of millions of people where there are real measures implemented and which they have contained the virus and virtually eliminated it. Not completely, of course, because we live in a global society. But there are arguments now being published in the New York Times and other American newspapers demanding that China, you know, remove these measures, and because they're holding up supply chain.
I've read that.
Yeah. Quite remarkable.
It is interesting, and it comes back to this question of, can you have a thriving economy while people are dying in large numbers? Well, actually, I think even from the standpoint of those who want to see a thriving economy, who want to see profits and people and consumerism, and it's even from that point of view, it's a false assumption, because it's not going to work. That's what I'm saying. That's what happened at Christmas. People didn't go and spend money and go out and have a good time, and businesses did not do well, and it's because people were concerned about the pandemic. People vote with their feet, and so I think that is, even on their own. I agree with what you're saying, that I think that that there are sometimes those who control the levers of power don't value the lives, don't value people's lives and well-being as much as the people would want them to. People want them to, but even so people need to express the view that we want our governments to protect us. We want to have policies that will prevent severe illness and death. And that's what our expectation is. But even on their own terms of the fact that we need employment, we need growth, whatever, even on those terms, we're only going to get that if we can control and essentially eliminate this pandemic as a threat to health. So whichever way you look at it, to me, the direction in which we're going is not sensible.
No, and we get the Omicron explosion. It is extraordinary. We've seen what those 26 days of the year, over 1,073 deaths. Figures now that just go off the scale, literally off the scale, compared to what had happened previously, and it's producing a tremendous crisis in the hospital system. Are you able to speak to any extent about that? Or?
Well, I'm aware, and that certainly the hospital system is stretched, and that information's in the public domain. That there are many, that the hospitals there's large numbers of hospital admissions, that many of the hospitals have had to defer admissions for other procedures or other illnesses, or divert patients because they're having to deal with patients who are there because of COVID. So, that our health system, our hospital system, and our health system in general, not just the hospital system, does not suffer from a lot of spare capacity. It's not, basically we run the hospital system at virtually 100% occupancy all the time before COVID. So if there are suddenly a huge number of more patients being admitted who were not being admitted previously, then something has to give. And we're not able to rapidly increase our capacity. And we can increase it a little, but not hugely. And so something has to give. So the care for patients who don't have COVID is one of the things that gives. So our capacity to deliver the sort of care that we would want to be able to deliver for other patients is limited. Of course, also, staff are under a lot of pressure. Staff are pressured to work to deal with a high throughput and difficult circumstances. Often they themselves have become ill, and not necessarily through transmission of the disease within the hospital, but just as members of the community, like everybody else, they're at risk of being infected. So the workforce is not just the work. All sorts of all parts of the workforce are adversely affected, including the health workforce. So yeah, it's a major problem for the health system.
In the last couple of months, we've seen less and less access to information about the infections, where they're spreading, etc. The testing, tracing, isolation sort of regime has broken down, and in the first last year, earlier, and previously, you could get much more detailed reports on where and how about the coronavirus, how it was operating, where infections. It's very difficult to get access to that material now. And in order to make considered judgments or balanced judgments, you need honest and accurate information.
Yeah, look, I agree. I think I don't want to be too critical of my colleagues in the Department of Health, because I think they're working under very difficult circumstances. In fact, they did a very good job for a long time. I think the information system basically became overwhelmed with the COVID, with the Omicron wave that hit us, and obviously the testing capacity of the PCR tests. So when all of the diagnoses were coming through PCR tests that people were having in public clinics, essentially, there was a centralized repository of information, and it was relatively easy to collate that information. I think it's now that many diagnoses are made by the rapid antigen tests, which people do themselves, even though they're now required or expected to report them, the information is just harder to collate, I think. I don't know either way that there's been any decision to withhold any information from the public. I just don't know that either way. But I do know that the capacity, that there's been an enormous wave of cases that has been hard for people to keep up with, and clearly you're right that I know many of my colleagues involved in the track and what they sometimes call contact tracing or track and trace, and trying to get people to isolate and to identify their contacts and get them to isolate. That was a heroic effort, really, and was done by it required a lot of person power, and it kept up for quite a long time, but it eventually became overwhelmed by the number of cases. And I guess that we need, if we're going to continue that, we need some sort of automated system that enables people to do that without having to have a human intervention. I suspect it's difficult, but I think that may be what's required.
Could you explain the elimination strategy you pursued in relationship to TB? How effective was it, and how could the lessons learned from that experience be applied in relationship to fighting COVID-19?
Well, I'd like to start that by saying by giving a bit of the history of what happened in Australia, actually, because we were remarkably successful in controlling tuberculosis. The control of tuberculosis was really enabled by the discovery of drugs that were effective in treating it, and that started in 1946 with streptomycin, and by 1951 we had enough drugs to effectively cure most patients with TB. We had trials, we had evidence that it was possible to treat and cure TB effectively, and we knew already quite a lot about that. We already also, even before that time, before we had drugs, we knew that you needed to isolate people who had TB so that they didn't infect other people, because like COVID, TB is an infectious disease. And the way to prevent people from getting it is to make sure they don't come into contact with other people who have the disease. So we used to, in the in the early part of the 20th century, and even in fact in the late 19th century, we had sanatoria, which is where people with TB went when they got sick, and they either recovered or they did not recover. Basically, largely, TB is a disease which without active treatment, about 50% of people survive, and roughly 50% of people ultimately die without treatment. The miraculous thing about treatment is that it cures nearly everybody of the disease. Very few people need to die of tuberculosis with treatment. Virtually everybody can be cured. And what's more, within about 2 weeks of starting on treatment, you're no longer infectious to other people. So you can be out in the community leading a normal life and not be a risk to infecting people. So in the old days, before treatment, the only way to protect people from being infected was to put them in a sanatorium until they either recovered or died. Now with treatment, all it's required is to get them onto treatment. And within a couple of weeks of they should stay at home for the first 2 weeks of treatment, so they're not infecting other people. But after that, they can go out and go about their own business. So in Australia in the 1940s, really, we started a national campaign, a national tuberculosis campaign, which was coordinated by the Commonwealth and managed with the states. And it included mass miniature chest x-rays. So people who are old enough will remember that there used to be caravans that would go around suburbs, shopping centres, towns, villages, and everybody would be invited to go and have a chest x-ray. That allowed us to find everybody in the population who had TB by x-raying them and put them on treatment and render them non-infected, both cure them so that they didn't go on to get sick and die, but also render them non-infectious so they didn't infect other people. And this started in the 40s, really gathered momentum in the 60s. And in the 60s, it became compulsory. And as in Australia, we have a great tradition of making things compulsory. So like voting, you can vote or you can pay $20. And it's the same with x-rays. You could have an x-ray or you could pay $20 or £10 or something. I don't know what you had to pay. But if you didn't have your x-ray, you got fined. So everybody had an x-ray. We found all the cases and we essentially eliminated tuberculosis. And if you're born in Australia, your chances of getting tuberculosis are vanishingly small. Essentially, we eliminated. So nearly all of the tuberculosis that occurs in Australia occurs in people who acquired the infection when they lived in a country where tuberculosis is not eliminated. The difference between tuberculosis and COVID is that it's what's called a latent infection. So you acquire the infection, but you don't actually necessarily get sick until many years later. Some people get sick a few months after they acquire the infection, but some people don't get sick until 30 or 40 years after they acquire the infection. So most cases of TB that occur in Australia occur in people who acquire the infection overseas. The infection is latent in them. It doesn't cause any symptoms. They're perfectly well. But for some reason, at some point in their life, the disease reactivates and they get sick. And that's where we treat them. But it's not a big problem in Australia. We don't have a major problem with tuberculosis in Australia. In the rest of the world, completely different proposition. Globally, tuberculosis is the biggest infectious disease killer of all diseases in the world. More people die of tuberculosis than any other infectious disease, except COVID. Until before COVID, now COVID is the biggest infectious disease killer in the world. But before COVID, it was TB. More people die of TB than die of HIV or than die of malaria or any other infectious disease. About 1.5 million people a year die of tuberculosis, and about 10 million people a year get sick with tuberculosis. And billions of people around the world carry the TB infection and are at risk of reactivating at some time during their life. So that's how we eliminate it in Australia, and that's the situation in the rest of the world. My view is that we stopped, this process of active case finding, to find all of the cases, treat them, and render them non-infectious, was done in some other countries as well. It was done in North America, it was done in Europe, the UK, and it achieved the same sort of result in most of those countries. None of those countries have a significant burden of tuberculosis because they essentially found all the cases, treated them, and prevented them from infecting others. But we did not do it in the rest of the world. And so the rest of the world is still back where the wealthier countries were prior to the 1950s and 60s. And so there's still uncontrolled spread of tuberculosis in many countries. And my view is we simply need to implement the same strategy of finding all the cases, treating them, and preventing people from being infected. It will take a few years, but ultimately we will get down to low levels. We won't completely eradicate tuberculosis. It won't disappear from the face of the earth, but it will be reduced to a sort of scalable problem like we have in Australia now, where it's not a major health problem. And eventually it will probably disappear. But my objective for tuberculosis is not to make it disappear from the face of the earth completely overnight. It's simply to reduce it to a problem which can be readily dealt with by the routine health system, and not one which is killing, hundreds of millions of people every year. In Vietnam, for example, about 15 or 16,000 deaths a year due to tuberculosis in a country of 100 million people. So, huge numbers of people are dying, often as young adults. Most of these deaths are occurring in young adults or middle-aged adults. And so this is avoidable. And I think, it's essentially the same argument that I was making with COVID. We just need some imagination, some vision, and some commitment, and it can actually be achieved. And we do have, in fact, the tools now that we have the drugs treated effectively, and we have the drugs, and we have the diagnostic capacity to do this. We just need the will to do it. And so I think this is a very important thing that we need to pursue at a sort of global level, is TB elimination. And we will, in many of these countries, tuberculosis is such a serious problem, not only killing a lot of people, but rendering people sick for a long period of time, occupying healthcare resources, that it is having a negative impact on the economy of these countries. And it's the same argument as I was making with COVID. You can't have a viable economy without a healthy population. And if you have serious illness in the population which is not being addressed, the economy suffers. If breadwinners, people in their most productive years of life, are becoming ill or dying with tuberculosis, this has a terribly depressing effect on people's well-being and livelihoods. So I think there are all sorts of important reasons why we need to tackle tuberculosis.
I think the points that you raise are very correct, that there has to be a global elimination strategy for TB, but also with the question of COVID. And for our party, and the World Socialist website, has been calling for the global elimination of COVID-19 and a coordinated international strategy really since the very beginning. And part of our fight for the elimination of COVID-19 has been the launching of the Global Workers Inquest that was launched, which seeks to investigate the origins, causes and consequences of the pandemic, but also exposing the political and economic forces responsible for allowing for its effectively uncontrolled transmission internationally. So I wondered if you could comment or what your thoughts are on our inquest that the World Socialist website has launched.
Well, I think if I could just come back to the TB analogy as well, because I think the same issues really relate to tuberculosis. There is this sense in relation to TB, and I guess it's maybe partly in relation to COVID as well, that this disease is an inevitability, and that well, there's two things around it. Let me just come back to TB and then I'll come to COVID for you. One of the things about TB is that people will say that TB is endemic in low-income countries because it's a disease of poverty. Well, to me, that sort of and so the consequence of that, people say, is the only solution to getting rid of TB is to get rid of poverty. Well, to my mind, I ask people, well, why is it a disease of poverty? What the reason it's a disease, we need to address that question. Why do you get this if you don't have the result? The reason it's a disease of poverty is that the health systems have not been resourced to be able to find the cases and treat them. That's ultimately the system. It's a lack of, it's basically the view of wealthy countries that poor countries can only afford poor quality healthcare. That's essentially what it comes down to. We can't afford to deliver the sort of healthcare that was required to eliminate tuberculosis for poor people living in poor countries. That's the view. And to some extent, it's the same thing with COVID. We can't, you can't expect poor countries to be able to effectively combat COVID because they're poor. Well, why? Why is that the case? I mean, we're in one world. Why is it that if you live in a poor country, you're not allowed to have an X-ray? You're allowed to be infected with TB. And if you live in a rich country, you're not allowed to be infected with TB. In Australia, if there's a case of tuberculosis in the community, there's all hell to pay. We have to do everything we can to make sure that nobody is infected. Nobody goes on to get tuberculosis. Whereas if you're in the Philippines, 1 in 100 people that you walk past in the street has tuberculosis and you're likely to be infected by that person. Well, why aren't the other 100 people, the other 99 people complaining about it? Why do they allow it to happen? And why do we allow it to happen? And there's this sort of nihilism and we can't afford that in a low-income country. We can't afford to do this. Well, I just don't accept that. And if we're going to wait until Malawi has a health system that looks like Sweden, we're going to be waiting a long time. We don't need the health system in Malawi to be a Swedish healthcare system. We just need people in Malawi to be screened for TB and for it to be eliminated. And we need them to be vaccinated against COVID. We don't need the whole, So I think there's this sort of, I think there's a lack of vision and a nihilism that is holding back countries from improving the health of their citizens. And we as a global community, I think, have a responsibility to overcome that reluctance, those barriers.
And the global inquest, the aim of the global inquest is to educate and, you know, create the conditions where ordinary people, workers, middle class people are told the truth about what has occurred in the last 3 years.
Sure.
And the dangers and what could have been done, and therefore what should be done today. And that, you know, we're fighting for that, the development of this movement from below, and for an alliance with the most principled, serious scientists involved in that process.
And so I think, you know, COVID in a way is, at one level, is even, you know, is not that complex. I'm not minimize, you know, it's rapidly evolving and it's new, and there's a lot of there's remarkable technological work that needs to be done. But actually, once we've done it, you know, essentially what needs to be done to eliminate it is not that, you know, the strategy that I've outlined will ultimately not, you know, it's not actually technically that complex. I mean, it's getting vaccine into people, not simple, but needs to be done at a very large scale. That's what needs to be done. We need to produce, distribute, and administer vaccine, probably an inhaled vaccine, actually, not even an injectable vaccine, to the world's population. And then we need, in addition, probably to provide, you know, people with effective masks that they can wear to prevent, while there is transmission going on in their community. When there is transmission going on in their community, they can wear to reduce the rate of transmission as an additional procedure. And we need this sort of ventilation, more understanding about ventilation. None of this is sort of rocket science. None of this is that complex that it can't be done or understood by people. You know, I think it's relatively simple procedure. I mean, I'm not saying that, you know, the development of the vaccine, it's not a done deal. You know, I'm not saying that it's there. It's not there. But, you know, it's, and we do need a better vaccine, even though the current vaccine is incredibly effective at what it does in protecting people from getting really serious illness and dying. It's not the vaccine that we ultimately need to eliminate the virus. And there is still work to be done. And I don't want to minimize that, but it is getting there.
Thanks so much for your time and your knowledge. Very enlightening comments you provided us with.
Okay.
And we should talk again. So
yeah, no, I enjoy these discussions with you.